Hello, my name is Julie Ann, and I've been with MIRCI for over 32 years and enjoy serving as the president and CEO. When I started in '91, the Friendship Center was actually what the organization was called at the time, and it had been operating since 1960, just kind of bridging a gap for folks coming out of the old state hospital and needing a place for socialization once they got back in the community. And within probably the first 3 or 4 years that I was there, as the hospital was deinstitutionalizing, as was happening all around the country, all of a sudden we had people coming in every day to use the Friendship Center, but bringing literally all their belongings with them. They were staying in a shelter, tucking their belongings under the stairwell, and spending the day with us. So in the mid-'90s, the agency started developing housing, and then in the late '90s, we began providing some clinical behavioral health care, and then by 2010, we were a full-blown behavioral health agency. We operate 3 behavioral health clinics in addition to providing housing and services to about 325 people a year. We have certainly seen that there is a need for individualized behavioral health care. It's really for some of the most vulnerable individuals, most symptomatic individuals with mental health issues. And so while we have behavioral health clinics, about 80% of our services are actually provided to people in the community and in their homes. So it allows us to keep people that might otherwise be hospitalized living in their community and becoming integrated back into their social support systems. We have licensed master social workers, we have licensed professional counselors, nurses that go into people's homes. It just meets people wherever they are. The needs are the same. I mean, when someone is struggling with their mental health, the biggest thing that matters anywhere is that you have a safe place to recover. Almost every person that works at MIRCI, if you were to ask them what's been the most impactful thing, is when they actually move somebody into their housing. Being able to give someone the key to their apartment. Like, we own 4 apartment communities, and then we place people in other multifamily. None of it's somewhere that I wouldn't live. If I wouldn't live there, we're not going to put, our residents there. And so for everyone, that's the most meaningful thing, when you can actually do that and a person goes in and can let their defenses down. It's amazing what providing that safe, inviting, engaging, welcoming space does for someone. There are many ways people can get involved on an individual basis, as a group. There's our website is MIRCI, MIRCI.org. There's information on there for how to reach out to volunteer. We get a lot of youth groups, we have church groups, we have corporations that volunteer with us. We're a United Way impact partner agency, so we have volunteers that come in through that process as well. So, and then of course, one way always to help is if someone doesn't have the time, contributions are always welcome. Everyone needs to take time for their mental health. Over the past 3 or 4 years, with the experiences around COVID, I think that the general public is beginning to realize just how fragile our mental health can be. I think that we've come a long way, especially with just the attention that the pandemic has had, and the public understanding that mental health is part of our health. It's just as important as, cardiac health or, anything else.